Hi, doctor. Let me ask you a few questions. It's an interview, and we're interviewing Dr. Joan Hoppert, chiropractor, here in Tucson, Arizona. Doctor, tell us a little bit about yourself.
I've been in practice since 1998, and I love what I do. I get to see miracles, and it's just so much fun to see people go from a place of being hopeless to being well and empowered. Um, yeah.
I think you're a mother.
Yes. I have mothered 6 children. None of them came through me, but I've adopted and I fostered and I've been a stepmom. So
And you have two of your foster children with you.
yes, I have a 10-year-old boy and an 11-year-old girl, and they are beautiful.
And I understand you love pets too.
Yes, yes, I have 2 angel doggies and 2 cats, and I used to have a parrot for 9 years. He flew into our life one day, and then he flew out 9 years later.
Incredible.
Yeah, it was an amazing gift. Amazing gift.
Very cool.
Yeah.
How long have you been in chiropractic care?
Myself, I'm 48, and I started receiving chiropractic care when I was 23. So a while.
25 years.
Yes.
And how long have you been a doctor in chiropractic?
I started my practice in 98.
1998.
1998, yes.
That's quite some time ago.
It is, and one of the things that I tell my practice members, the people who come here for care, is that I feel and I know that I'm more flexible now. I'm certainly more happy. I'm more resourceful and healthier than I was when at age 23, which most people, they can't even compute that. You know, they think you get older, you get sicker, you get less flexible, and that is not the case with me.
You graduated from the Sherman College of Chiropractic?
Yes. Uh-huh.
And before that you were at Cornell University?
Yes.
What did you study?
I received a bachelor's in social work from Cornell University.
I see, and then you decided to become a chiropractor?
Not exactly. I first was a labor union organizer. I worked helping poor people get better wages and health insurance. And it was then that I became a patient of a chiropractor, a wonderful chiropractor. And it so helped me that I was pretty much compelled to become one myself over a period of time. It was a calling, for sure.
Great. When you started chiropractic, you were trained as a traditional chiropractor, is that correct?
Not really. So I went to chiropractic school, and I went to explore all that chiropractic had to offer. And at the time I went, they weren't really even teaching network spinal analysis, which is the particular form of chiropractic that I use in schools. But it just so happens that the founder's son went to school when I went to school. So we were learning it in clubs, and we were practicing it on each other. And so I've been actually using this particular method since day one. But I explored others because chiropractic has many different techniques and avenues, but nothing came close to the power of this particular form of chiropractic.
So we're talking about what we call NSA, or network spinal analysis.
Exactly.
Can you describe in a few words what are the most major differences between traditional or conventional chiropractic and NSA?
Yes. So one big distinction is that NSA is very, very gentle. There's no twisting, no popping of that. Another major difference is that its focus is to wake up the healing power within the patient or practice member, as we call them. And the other difference is that we go to the area of the body that is most alive and most has free energy, as opposed to where most everyone else goes is to where it's most rigid, most fixated, most distressed. So we work with what is working and we amplify that.
Because?
Because that's what works. We find when you work with the body and you go with where there's ease, first of all, you don't have to use much force. And second of all, you wake up the body's intelligence instead of having to fight you. Because if you go where it's rigid, if you go where it's protected, if you go where it really hurts, that's the body's armor. That's the body saying, please leave me alone. So we go to where there is actually an opening in the nervous system, in the body's own intelligence, and say, hey, let's pay attention here. And as the body takes that stimulus, it's able to reorganize.
Do you find the patients respond better to this approach?
They respond phenomenally to this approach. The results are really very quick and very powerful. And for people who've had a lot of trauma, especially emotional trauma, and especially young and early ages, they're very guarded and they're very defended for good reason. And they do not do well with approaches that are vigorous and forceful.
So what kind of results, or what kind of immediate benefits, rather, can a person expect when they come to see you?
So the very first thing that people notice, and I look for to assess whether I'm doing a good job or not, is the breath. Okay, people notice they breathe easier, they breathe fuller. And you think, oh, well, so what? Okay, but if you ain't breathing, you know, you're barely alive. Okay, I always say, living people breathe, dead people don't. So if you start breathing more fully, it means you're more alive. And it is that breath flowing through the body that reorganizes the tension and allows the healing process to deepen. So people notice that, they notice more flexibility, they notice that they handle stress better. And stress is one of the big things that causes a lot of illness. Not stress per se, but the inability to adapt to it and deal with it. And so they notice that they're more flexible, and the things that used to just drive them crazy, it's like, not such a big deal.
Can you tell us a story that illustrates this?
This principle?
Yeah, this principles, yeah.
Okay. I will tell you about one of my clients who comes here. And this is a gentleman that is a veteran, a Vietnam veteran, and when he first came here, about a year ago, he was in constant pain in his foot. It had been injured in the war. When he returned, he had 5 operations on the foot, and they never were able to deal with the pain, take away the pain, and he'd lost the ability to place the foot flat on the floor. The ankle had to be elevated. It was kind of locked and locked in a position. And the worst part of this was that every time he felt the pain, it would remind him of those horrors. So there was some really severe post-traumatic stress with this, which went undiagnosed by the VA for years. So anyway, he came to see me, and I think he was pretty skeptical. I mean, he'd had this forever. And within a very short time, he had no pain in his ankle. And more importantly, a lot of the horror and the distress that came and associated with that and the memories of the war dissipated. And one of the things that I was most excited about is that he and his wife, who also started care here, have now had a very, very good relationship, whereas before it was filled with distress because he was hurting all the time and angry and upset. And he now has a good relationship with his daughter and his granddaughter. So the healing of that one person actually helped heal the whole family.
Great. Do you treat children?
Oh, yes. That's my favorite. Because the potential, you can work with a child who has no symptoms and no problems. And you can help that child become more resourceful, more flexible, better concentration. And you can help that nervous system of that child evolve so that they can access more and more of their potential. And I love that. But most of the children who I work with, and I work with quite a few, come with problems because they've already been exposed to way too much stress and their nervous system cannot adapt to it. But I just know that if they hadn't got this care now, I might be seeing them, or someone else would be seeing them in 20 and 30 years with much more serious problems, tied back to what's going on now that was not ever fully addressed or addressed at all.
We're in the desert in Tucson, and do you see pathologies that are specific to the area among your patients?
No, I don't. Not that I'm aware of.
One of the things that people say about chiropractors is that once you're into chiropractic, it's very difficult to, go outside of chiropractic, or you're into chiropractic for the long term.
Right.
What do you think of that?
You have to go forever.
Yes,
Yeah.
that's what it says. So what do you
Yes.
think about that?
So what I tell our practice members, the people who come here for care, is it depends on what you want. For some people, they just want to be out of pain. And I can understand that, okay? And so that may be the only piece that they want. Now, for most people who come into this practice, they may even start there, but once they see that the pain is really just a symptom of a larger problem, of a body that's not working well, of a life that's not working well, many want to continue because they say, wow, if I can feel this good after 2 weeks, how might I feel after 2 months? And for people like myself, now I've had care since I was 23. I would not stop this care because it keeps me at the top of my game. It keeps me more connected. It keeps my heart more open. It's kind of like going to the gym. Would you stop going after a month if you lost 10 pounds and you felt better than ever? No, you'd say, I want more of this. So this is definitely something you could do for life, but it's not something you have to do for life. You get to choose.
When you see and when you meet a patient for the first time, do you form a pretty good idea of what they have as you start the first treatment, the first entrainment?
The body, when I put my hands on a person, the body tells a story. You get a huge sense of a person's history. You can get a sense of if there was a trauma. You could get a sense of just how many years that was ago by the different things that we analyze. So the body tells a huge story. And the body also is, it really reflects what will happen with our future and our destiny, because if we are rotting and we are rigid and we are breaking down, that's going to be one pathway. And if we take care of ourselves and that shifts, that's going to be another pathway. So yeah.
Can you tell something to the viewers about posture?
Oh, okay. So here we see posture as a window into the health of the spine, the nervous system, and the body. Now, if my posture is like this, okay, that's a sign that there is rigidity, that there is tension, that there is a lack of adaptability. And if you think about it, if you see someone, you walk in a room and you see somebody like this, you're probably thinking, ooh, they're not having the best day, right? Or maybe I don't even want to talk to them today. Because our posture reflects our emotional state, our ability of what's going on in the moment, okay? So, and postures should and will change, but as your spine gets sicker and sicker, you get locked into one posture, and that is the definition of illness, because you're no longer flexible.
You organize seminars and you give lectures and things like this, and you organize seminars for patients and their families directly in your practice. Can you tell us a little bit more about that?
Sure. We do that once a month right here at the office, and we do that at no charge. And we do that because this paradigm is so different. The way we approach the body, the results that we get, the way that we respect the person and work with the whole person, not just the symptom. There's so many aspects of this that are different, and we find that people are interested. Why is it you do this, and why does this happen after an entrainment? And so we're able to address all of that. And I find that the people who can make this and attend actually progress faster, because they hear about the research behind network spinal analysis, they see a demonstration, And then they're able to talk to other people who are just starting care and hearing about, oh wow, this really cool thing happened. So yes.
A part of your practice is oriented towards breathing techniques,
Yes.
which you call
Yes.
SRI. Can you tell us a little bit more?
Surely. The founder of this particular form of chiropractic, network spinal analysis, also founded something called somato-respiratory integration, SRI for short. And that is a form of healing that works on the front of the body. And it works in specific parts of the body that have a lot of nerve supply to the vagus nerve, which is the nerve, part of the nervous system that deals with healing, digestion, rest. And for most people, especially in our culture, we do not have a lot of access to that. We're really in the go, 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 fight or flight mode, not in the rest, digest, and heal mode. So it stimulates that part of the body, it increases awareness, and it increases our ability to feel and be aware of what's happening inside our body.
Thank you very much, Doctor.
Thank you.